What if you were told that a simple exercise could help manage some common issues faced by women due to weak pelvic floor muscles? Yes, it's true. Kegel exercises, also known as pelvic floor muscle training, can be an effective solution for many. These exercises strengthen the pelvic floor muscles that support the uterus, bladder, small intestine, and rectum. A multitude of factors can weaken pelvic floor muscles, including pregnancy, childbirth, surgery, aging, excessive straining from constipation or chronic coughing, and even being overweight. Kegel exercises can be particularly beneficial if you experience issues such as leaking a few drops of urine while sneezing, laughing, or coughing, known as stress incontinence. They can also help if you have a strong, sudden urge to urinate just before losing a large amount of urine, known as urinary urge incontinence, or if you experience fecal incontinence. However, these exercises are less helpful for women who have severe urine leakage when they sneeze, cough, or laugh, and for women who unexpectedly leak small amounts of urine due to a full bladder, known as overflow incontinence. Now, here's how to do Kegel exercises. First, identify the right muscles. To do this, stop urination in midstream. Once you've identified your pelvic floor muscles, you can do the exercises in any position, although lying down might be easiest initially. To do Kegels, imagine sitting on a marble and tighten your pelvic muscles as if you're lifting the marble. Try it for 3 seconds at a time, then relax for a count of 3. For best results, focus on tightening only your pelvic floor muscles. Be careful not to flex the muscles in your abdomen, thighs, or buttocks. Breathe freely during the exercises. Aim for at least 3 sets of 10 to 15 repetitions a day. Remember not to make a habit of using Kegel exercises to start and stop your urine stream. Doing so can lead to incomplete emptying of the bladder, increasing the risk of a urinary tract infection. If you're having trouble doing Kegel exercises, don't hesitate to ask for help. Your doctor can provide important feedback so you can learn to isolate and exercise the correct muscles. In some cases, vaginal weighted cones or biofeedback might help. Finally, expect results. If you do Kegel exercises regularly, you can expect less frequent urine leakage within a few weeks to a few months. For continued benefits, make Kegel exercises a permanent part of your daily routine. So there you have it. A simple guide to Kegel exercises, a potential solution to common issues faced due to weak pelvic floor muscles. Remember, consistency is key, and don't hesitate to seek professional advice if needed.